borderline personality disorder. And I'm showing this Venn diagram. I'm sure you'll remember from high school algebra what a Venn diagram is, but if you're like me, you're probably more interested in looking at your girlfriend or boyfriend than trying to figure out what a Venn diagram is. But if you'll note on the chart, the borderline is the borderline personality disorder is that midsection, and it's a combination of mood and anxiety disorders and impulse control disorders. Borderline personality disorder, first of all, I think is a misnomer. The title, borderline, is I think very misleading. Even if we look at the basic definition of borderline, it indicates, well, barely acceptable in quality or as belonging to a category on the borderline. For example, references may be requested in borderline cases. Well, I think that's one of the reasons that this is so misunderstood, and I certainly don't hold myself out as an expert, but I have done a good bit of research with regard to borderline personality disorder, and I think that as a generalization, I think Social Security adjudicators have very poor understanding as to what borderline personality disorder actually means. A woman psychologist by the name of Marcia Lynham, she's with the University of Washington, psychologist there. She's considered probably the expert on borderline personality disorder. Has done a great deal of research related to this type of mental health problem. She has reported in the Journal of Clinical Psychology and other accepted professional publications, for example, that folks who are in the borderline category are actually the equivalent of third-degree burn patients. In other words, the people with borderline personality disorder are the folks that are most disturbed, and it's a shame, really, that the name borderline is very misleading, and I think it's misleading to the administrative law judges as well. I was at a hearing not too long ago, and I was attempting to explain to the administrative law judge more detail about borderline personality disorder, because it's only natural. The administrative law judges, they look at listing 12.08 and they utilize that as the basis for their decision. But that's not necessarily an accurate decision. So I was attempting to provide more information to the administrative law judge, and of course he shut me down and said, well, I know what borderline personality disorder is. And I kind of felt like Jerry Seinfeld in a sense, and almost said, well, I don't think you do. Of course I didn't, because none of us want to jeopardize our claimant standing and by being a little bit of a smart aleck. But I honestly, that was really what I was thinking. I don't think you do. Patients in this category, again, I'm quoting the experts, 75% of these folks hurt themselves cutting. We're familiar with that. We see a number of our clients who do that. Other ways of hurting themselves. And sadly, 10% of the people who have this diagnosis end up committing suicide, compared to 6% of people who have generalized mood disorders. So it's It's a sad, sad diagnosis. And these people, excuse me, frog in my throat today. As Dr. Lynham points out, these people are very capable of deep love and profound rage almost simultaneously, and they're powerfully committed to the people that surround them and the people that they love. But they can unexpectedly go off on a deep rage and in effect chase away the people that they most love and really want around them to help them maintain their mental health. So it's sad. It's a very sad diagnosis. Very misunderstood. I have to read this because I'm quoting from the experts. But I think this is particularly significant when it talks about brain factors. And the quote indicates, quote, studies show that people with borderline personality disorder can have structural and functional changes in the brain, especially in the areas that control impulses and emotional regulation. But it is not clear totally whether these changes are risk factors for the disorder or caused by the disorder itself. And of course, they go on to say that other risk factors include, of course, the environment, cultural, and social factors. And we see this. In other words, when I say we, I'm talking about the folks who represent people applying for Social Security disability. But we see the trauma that many of our clients have had in their lives. Many of them have been emotionally abused as children. Many of them have sadly been sexually abused as children, in some cases by their own parents, and in other cases by other family members. But all of these things coming together result in a person having a significant mental health problem to deal with. When I started this conversation, I held up this page in order to try to illustrate how, in the form of a Venn diagram, the experts really describe borderline personality disorder, because the person has a mood and anxiety disorders and also combined with impulse control problems such as overeating, substance abuse, inappropriate anger, things of that sort. And of course, as far as the mood and anxiety disorders, they have, the traditional emotional regulation problems like depression, bipolar disorder, generalized anxiety disorder, and social phobia. And so these things kind of overlap, if you will, and then cause that what the treating sources call borderline personality disorder. And that's really where the complications come in for the patient. Dr. Lynham and others have indicated that in order for a person to be diagnosed with borderline personality disorder, they must have, they're basically defined by the inability to regulate their emotions. Patients must meet at least 5 of these categories in order to be diagnosed with borderline personality disorder. I'll mention those quickly. I think this is coming more from the DSM, but this is from an article published by Dr. Lynham. Stress-related paranoia, frantic efforts to avoid abandonment, unstable relationships, unstable self-image, impulsivity, recurrent suicidal behavior, mood instability, chronic feelings of emptiness, inappropriate anger, and a person doesn't have to have all of those as indicated. The experts say they have to have 5 of those. But it's a devastating diagnosis. But just a final thought as I close this discussion. I think it's important to remember, though, as I indicated at the outset, that the experts view this as the equivalent of the third-degree burn patients. In other words, folks with a borderline personality disorder are in a category that's considered most severe by the experts who treat these people. And I think, again, by way of summary, and as I indicated at the outset, I think it's very unfortunate that this particular impairment has been labeled as borderline personality, because that carries with it the implication that I mentioned earlier. So with that, I'll stop. I can be reached at 800-900-4440. I've represented claimants for disability for the past 25 years. I can be reached by email at hermanadvantage@gmail.com. That's 1 R 2 N's, HERMANN, advantage @gmail.com. But I wanted to provide some insight into what I know is a very misunderstood diagnosis, a diagnosis that for me has been not well understood, and that's why I wanted to do additional research related to that diagnosis. But if you find this helpful, I'd appreciate if you'd give me a thumbs up, and also subscribe to any YouTubes that I publish in the future. So thank you very much.